You can train, eat clean, and still age faster than you should, if inflammation is running the show. You may not feel inflamed at all. You just feel older, slower to recover, and hungrier than your lifestyle should allow. Today we're giving you an inflammation scorecard, 3 labs that act like a hidden dashboard: hs-CRP, ferritin, and homocysteine. You'll learn what to test, what high usually means, and a 30-day plan that can move the numbers without turning your life into a science fair. Here's the scene: 2 people eat similarly, train similarly, and both say they don't do junk. One feels sharp and bounces back, and the other feels puffy, sore, foggy, and stuck. Often the difference isn't motivation, it's hidden friction. That friction can be sleep debt, visceral fat, alcohol, gum inflammation, fatty liver, untreated sleep apnea, infections, or a nutrient bottleneck. Chronic low-grade inflammation pushes cardiovascular and metabolic risk, and it wrecks recovery. So the goal is to find your biggest drivers, not chase random supplements. Your dashboard is simple. hs-CRP is your smoke alarm for systemic inflammation and shows up in cardiovascular risk discussions. Ferritin is your iron warehouse, but it also rises with inflammation and liver stress, so it's commonly misread. Homocysteine is a vascular stress marker influenced by B vitamin status and kidney, thyroid context. These 3 together tell you whether the fire is systemic inflammation, liver, metabolic stress, or a nutrient processing bottleneck. And yes, your body is that complicated because it hates us. Before numbers, a rule that prevents lab anxiety. Don't test during obvious illness or injury, or right after extreme training, and don't build a new identity from one draw. If a result surprises you, repeat it when you're stable, then decide what it means. This is educational, not medical advice. Use it to talk with your clinician. If you're ordering labs, consider hs-CRP, ferritin plus an iron panel, so TSAT is available, and homocysteine alongside B12 and folate. That one add-on step prevents 80% of "I saw a number and panicked" mistakes. Marker 1 is hs-CRP. CRP is produced largely by the liver in response to inflammatory signaling, and the high-sensitivity version detects low-grade inflammation relevant to chronic disease risk. It's a signal, not a standalone diagnosis. What counts as high? A common framework is under 1 mg per liter lower risk, 1 to 3 moderate, over 3 higher. Many prevention discussions treat hs-CRP above 2 mg per liter as a cardiovascular risk enhancer, meaning it can tilt prevention decisions when overall risk is borderline. When should you worry? A single mildly elevated hs-CRP is often just life showing up: poor sleep, visceral fat, alcohol, a tough training week, even a minor infection you shrugged off. But if it's very high, especially above 10 mg per liter, think acute inflammation or infection and repeat later, rather than declaring inflammaging. What raises hs-CRP most? Visceral fat is huge, because fat tissue produces inflammatory signals, and alcohol and smoking can amplify it. If hs-CRP stays elevated despite good habits, consider hidden drivers like fatty liver patterns, autoimmune, inflammatory conditions, chronic infections, gum disease, or sleep-disordered breathing. This is where test, don't guess, helps. You're not broken, you're just missing a piece of the map. And sometimes the fix is less biohacking and more go to the dentist and stop sleeping 4 hours. Marker 2 is ferritin. Ferritin stores iron, but it also rises with inflammation and liver stress. Elevated ferritin does not automatically mean iron overload. There are 2 buckets. Bucket A is inflammation, metabolic, liver stress, very common with visceral fat, insulin resistance, fatty liver risk, and daily alcohol. Bucket B is iron overload, important not to miss, where iron accumulates over time and raises organ risk. Separate the buckets with iron studies, especially transferrin saturation, TSAT. In many algorithms, iron overload can generally be excluded when TSAT is under about 45%. If TSAT is high repeatedly, especially with high ferritin, get a clinician workup. When should you worry about ferritin? Don't panic over mild elevations with normal TSAT and obvious metabolic, alcohol drivers. De-escalate if ferritin is high with high TSAT, or if ferritin is very high. Often around 1000 nanograms per milliliter gets attention, especially with abnormal liver enzymes, symptoms, or a strong family history. Marker 3 is homocysteine. Homocysteine is an intermediate in amino acid metabolism, and folate, B12, and B6 help process it. Low intake or absorption can raise it, and so can kidney dysfunction and hypothyroidism. Labs vary, but many reference ranges sit roughly around 5 to 15 μmol per liter. Higher levels are associated with vascular risk observationally, but outcomes are nuanced. The honest take: fix deficiencies and root causes, don't treat it like a magic lever. Yes, B vitamins lower homocysteine reliably, but large randomized trials and meta-analyses did not consistently show fewer major cardiovascular events from homocysteine lowering in typical high-risk populations. Some analyses suggest stroke benefit in certain contexts, so who benefits matters. Quick safety note: don't megads B vitamins, just in case. Food first is the default, with targeted supplementation guided by labs and your clinician. If you ever feel tempted to go mega, remember, more is not a strategy. Now the good news: the same high ROI levers tend to improve all three markers. Food levers first. Mediterranean-style patterns are often associated with lower inflammatory markers in studies. Build a base of vegetables and legumes most days, fruit, extra virgin olive oil, nuts, and fatty fish a couple times per week, with adequate protein for 40+. The biggest lever that looks like diet, but behaves like medicine is visceral fat. Even modest weight loss is commonly associated with lower CRP. So if your waistline is trending up, make that your main project, slowly and sustainably. Alcohol is a stealth amplifier for both ferritin and hs-CRP. If either is elevated, a 30-day alcohol pause is one of the cleanest experiments you can run. It removes noise and often improves liver stress. Sleep and stress are the inflammation you can't out-supplement. Short sleep and irregular timing worsen appetite signaling, glucose control, and recovery. If you snore, wake unrefreshed, get morning headaches or dry mouth, or your blood pressure is creeping up, consider sleep apnea evaluation. Here's your 30-day plan. Days 1 to 7, remove accelerants, cut alcohol to 0 to 2 days per week, or pause if ferritin is high, remove daily ultra-processed offenders, and lock a consistent wake time with 30 to 60 more minutes of time in bed. Days 8 to 14, add Mediterranean non-negotiables, daily vegetables plus olive oil, legumes 3 to 4 times, fatty fish twice, and fiber gradually toward 25 to 40 grams per day if tolerated. Days 15 to 21, move like it matters, about 150 minutes of moderate cardio plus 2 strength sessions, and add 10 to 15-minute walks after meals. Days 22 to 30, fix hidden drivers, oral health consistency, apnea testing if suspicious, and a 5-minute daily downshift, nasal breathing, a short walk, or a worry list then plan tomorrow, dump. Marker-specific tweaks, quickly. If hs-CRP is high, prioritize waistline trajectory, sleep consistency, alcohol reduction, and training balance. If ferritin is high, don't assume overload, pair with TSAT and discuss liver, metabolic workup with a clinician. If homocysteine is high, check B12, folate status, consider kidney, thyroid context, and correct deficiencies without megadosing. When should you retest? For hs-CRP, repeat elevated results when you're stable, and many clinicians interpret an average of 2 tests. Ferritin usually changes over weeks to months, and homocysteine often responds over weeks once deficiencies are corrected. Think 30 days to start the shift, then retest on a timeline that matches your situation. Final checkpoint: don't worry about a mild one-off hs-CRP bump, but do worry about persistent elevation or very high results that don't resolve. Don't worry about mild ferritin elevation with normal TSAT and clear metabolic drivers, but do worry about high TSAT plus high ferritin or very high ferritin. Don't worry about modest homocysteine elevation with an obvious nutrition story, but do worry if it's high with anemia, neurologic symptoms, kidney disease, or hypothyroid signs. If you've ever felt like you're doing everything right but still not getting the results you deserve, this scorecard is your reality check. If this helped, hit like and subscribe, and check the description for the tools that match today's topic and our Longevity Compass Amazon KDP book. And remember, you don't have to argue with inflammation, you can measure it, interpret it, and lower it with basics that actually work.